Morning, everyone. What a venue. It's really great to be here. I was here at the same event supporting it back in the Barbican last year. I think it was in Birmingham the year before. And it's always been a very special event that I think, we've prioritised to make quite sure we support. But, I'm going to say the same as Tim here. I mean, Guy's introduction is absolutely lovely. And I kind of have to pinch myself, really, I think, and work out how I got here. But I guess one of the most important things that is why we've got here as part of being a director in NHS England and the work that we're doing for our armed forces community is because there are so many people who care. And there are so many people who work hard and really understand this agenda. What that does expose, though, is also how big sometimes it feels it is to kind of turn that tanker of absolutely the understanding and achieving for all of the members of the armed forces community, both serving reservists and their families, and also for what that means for veterans and their families. And thank you, because I know that all 260 odd people that are in this room are absolutely the reason why Tim and I, particularly in the introduction, and Guy can say what we're saying. And I may just repeat a little bit of what has been said before, so bear with me if I do the button because it helps. So yeah, I have a horrendously long title. There is another part of my title, as I've just taken on supporting the NHS England in migration and immigration pathways as well, which I guess I probably do in many respects, but it's all about making quite sure you bring partnerships together. I call it a bit of a knitting pattern. It's absolutely at times where sometimes you have a jumper with one arm and, kind of half a big hole in the front of it. But, there is a way of actually stitching it through. There is a way of making it absolutely the right thing. So I think for a lot of the repeats from, I guess, really from where Tim started, what we're here really in NHS to do is actually say how far we have come as an armed forces healthcare community. And it has been tricky at times. And I think part of that is recognising where we are now and what that means for the next 5-6 years, and actually getting that inspire, getting that ambition really part of where I kind of want to kind of push that today. I remember, Tim, I think it was back in 2013-14. And by the way, I'm a woman of a certain age, so I have a fan that goes everywhere with me. My daughter lives in Liverpool. She actually lives in New Brighton. And I stayed with her last night. And the first thing she did was present me with a fan to stay in her house for the night, because she knows what I'm like. And women know what I'm saying, as well as I know partners of maybe women of a certain age as well. So let me carry on, and you can enjoy my fan. So I think one of the things that Tim and I did back in sort of about 2014, I think we were at number 11, if I remember, not number 10, it was number 11, but nevertheless still in the famous Downing Street. And I think it probably is the best description. It felt like we were really with a begging bowl to get some key new government then, let's be honest about it, it was the coalition government, some key understanding and some key resource to kickstart what we've actually got now. And that was difficult. And I know there's some really important people in this room today who were part of that journey when we were looking at, I think, in NHS England, something like it's not just about money, it's about people. But it really helps to put the resource around excellence. But we were looking at something like £18,000, I think, that was part of, Andy will tell me if I got that right or wrong, part of the infrastructure of supporting the armed forces community back in 2013-14. What Tim and I were doing, what Dr. Jonathan Leach was doing, what a number of people in this room were doing, was ensuring that we got the government of the day to understand you had to invest in your armed forces covenant. You had to invest in the armed forces community, because the answers were there. It was just about the ambition and the aspire. And I know for a lot of you today, because I've had the pleasure of talking to people yesterday, and the amazing event, thank you very much, Guy and colleagues, with a fantastic Catterick band, where we are still, pushing that bar, I guess, really, Tim, as part of what that means. So what that means that the long-term plan will be renewed, as Tim has already said. It also means that the Armed Forces Forward View and what it means for those 9 commitments, which I think stand pretty fast and pretty strong. But actually, what does that mean for the future? It does mean that we have committed and supported over 50 programs of work as part of a national armed forces team. And, I get my name mentioned quite a lot, which is lovely. And my mum, who recently passed away, would be giggling her head off at the moment because she was my toughest critic. But it's actually the Armed Forces National Team, Deborah Elliott and the team, and Nikki and Dr. Jonathan Leach and H, and Richard Swarbrick is here today. That it's only a team of 7 leaders actually that have absolutely moved this mountain over the last 10 years. What that has meant is that our strategic approach is now embedded in everything that NHS services are doing. However, it's still not always there. It is about commissioning those dedicated services, increasing knowledge. There's a lot of knowledge in this room. I'm speaking to the converted, to the interested, but there is a bigger audience out there, Tim, for us to obviously keep pursuing, and I know that is working well. But it's also about improving the awareness, as Johnson was saying, of a much younger armed forces veteran community, of a different makeup as well with reservists. What does that mean, particularly for families and carers? What does that mean for different parts of the country? I think it's so important that we're here in the north, and what that means for probably the largest recruiting part of the country for the armed forces community traditionally, and still the same as it is. What does that mean for the difference of the armed forces community around equality and diversity? The work that we've done with women, with girls, with boys, with children, what that means around the LGBT community. And we know from Fighting with Pride, that's been a really tough journey for many over the last few years. What does that also mean as part of race and ethnicity? And obviously difference as part of people's backgrounds, but also difference as part of what that means in geographical terms. A lot of the stuff has been traditionally down south, in inverted commas, in the past. And I'm a woman from down south and up north, as far as my family is concerned. So I feel qualified to be passionate about both. But I think commissioning now, from the NHS perspective, the core services of Op Courage for mental health pathways, Op Restore for the physical trauma, the work that we're doing around Op Nova and criminal justice systems, and some of the numbers that are on these slides that you can see, which are now about business as usual for the armed forces community and as part of the protected characteristics. However, what that does mean, as Tim has already outlined as part of today's event, we've got to embed it in the strategic infrastructure. That's sometimes, kind of maybe slightly dull, but that is absolutely the bit that makes all the difference. I know I have spoken to people in large trusts. I have spoken to people within mental health trusts. CNWL is one of those that is obviously a really good supporter, but still feeling like they're kind of wading through treacle in sometimes getting the infrastructure to really buy in and own what that means going forward. But we know from the work that we did, particularly led by Dr. Leach, around RCGP accreditation, veterans accreditation, the work we've done, particularly with the work with PCNs now, primary care networks, that we're now up to 97%, Deborah will probably correct me on that, as part of the coverage across GPs. And I know Jonathan's here somewhere. I can't see where you are, but you're going to wave at me. Thank you. I remember the train journey, Jonathan, that we had. I think it was between Birmingham and somewhere else, talking about the concept of getting all GPs practices, all primary care practices and all PCNs understanding what it means as far as the armed forces community is concerned. That again was about 10 years ago. And we are now at this point of absolutely making quite sure it's embedded in the next part of the 10-year plan. Right, this is really the message I really want to get home, I guess, today. And I know that Tim's helped me with this greatly. And it's that old picture again of a bit of a milestone moment last week of Amanda Pritchard and the Surgeon General committing and signing, I'll say it in that order, to the NHS and the MOD and Defence Medical Services, the partnership work and the understanding of what that means for the armed forces community. I'm going to read you something that's not yet published, which Deborah Elliott, the Senior Director for my Armed Forces team, and I purposely wanted to do for today, Tim and Guy. And particularly, I'm going to just call out Jonathan, Nikki, Richard. You won't have heard this either, but it's because of the massive amount of work of the lived experience, the clinical, thank you, Tim, community, that we're now working with Amanda and the whole of the NHS England board to say what next, particularly with the Davies assessment that is going on at the moment, is likely to be published probably by this time tomorrow, but let's wait and see. So the Armed Forces National Team and the Armed Forces Single National Commitment around healthcare commissioning will be developing and producing a set of resources, including a framework to support regions, integrated care boards and NHS trusts that will guide, assist for them to demonstrate their commitment to and the delivery of the Armed Forces Covenant principles as part of their statutory duties, and with full coverage across England by the end of 25-26. Jonathan, I can't see you smiling. You're too far away and I've got bad eyesight, but I hope you are. So the Armed Forces Covenant has been there for a long time. It actually came as part of the Blair government. But if I ask every single one of you in this room, what does the Armed Forces Covenant mean? If I asked your chief exec of a hospital trust or an individual patient or a clinician or a charitable sector that are crucial to the work that we're doing, then I think we still get a varied response. What we want to do is go back to go forward with the commitments that we've got, particularly as part of a new government and also as part of an old government, but also the work that we're obviously doing with the MOD and everything that Tim and Guy and everyone have demonstrated today. And it's the same for Op Restore, it's the same for our Op Community and certainly for Op Nova and certainly for Op Courage as well. So what that means is that the review of the Armed Forces Covenant and the partnership work that we will continue to do formally with the MOD will highlight the commitment and the good practice. I know there's a number of ICBs, for example, in this room, integrated care boards, who are doing some superb work. Someone was telling me only about an hour ago about Somerset and the work that you're doing in Somerset. And I know certainly I've been up to Sheffield, Blackpool, Hertford, Norfolk, so on and so forth, where the whole maturity of that is really great. But again, there are still some areas that are committed, but not necessarily going wider and deeper. And it's the wider and deeper element that is part of the future and 24, 25. It's not chucking the baby out with the bathwater with the great work. And as you've said, Tim, how far we've come as part of demonstrating this through data, through evidence, through lived experience, for individual stories. But it is absolutely about the moment in time that we have now. And it's not political. It is a fact that with a new government that is really interested, and also with the Lord Robertson review that John Healey, as the Secretary of State for MOD, is also overseeing, that we are now actively engaged with kind of building on what that means and driving improvement, but also making quite sure that Amanda Pritchard, as the chief exec, signing this whole commitment really drives even more. Let me just, I suppose, reflect from a bit of a Kate Davies point of view, really, what this means at this point of time with a new government and everything else. We've kept going, I think, haven't we, Tim, when it's been CCGs to ICBs, and it was primary care trust before that, and I think before that it was SHAs before this came in. So he doesn't really matter about necessarily the model of commissioning infrastructure, but it's actually what it means for patients, for people, for staff, as part of, you know, a gift really, as part of this additional element and resource. So that commitment will reinforce the collaboration working, and it also will renew some of the programs of work that we've already got, but maybe also as part of the wider and deeper approach, what we still haven't supported or needed to affect and have impact on, and be able to measure it, as Tim said really, between data and assurance. So I think we're subject to the outcomes. There isn't anywhere that any of us, I think, go where we don't hear of a difficult family or individual personnel from reservists serving or veterans position or point of view. But let me assure you, and I'm not doing this because I'm standing up here with this job and this role, which I'm really humbled to be able to have, but we have absolutely collectively influenced and enabled thousands, and I would even go as far as hundreds of thousands of people within the NHS as patients in the last 3 years. It's quite new still as part of a robust infrastructure to really have and support building on what the Armed Forces for Community View absolutely meant when we published it just literally the month before COVID all sort of hit us in March 2020. So look, I'm going to thank you. I'm going to finish there. But what I do want to do is just kind of highlight just a couple of things before I conclude, really. So governance is really important, this, Tim, and I know you all help me and support me in this. It's the national governance of the NHS as we go through changing times with the Davies assessment and also with the work that we're doing with the new 10-year plan. It is really important that ICBs look at their governance as the absolute main, that's where the £160 billion worth of healthcare funding goes brilliantly into population-based commissioning. But your governance has also really, really got to establish and enable that to be a really strong and important commitment. I absolutely know that I think there will be every population integrated care board where we can say there is great work going on. And I'm not having a go at anyone individually. I'm just using the platform, really. Saying we do some great work with with Royal British Legion, or we're giving out and supporting what that means for Rock Courage is fabulous. But that doesn't mean that that's part of the Armed Forces commitment. We don't want Johnson's story when he goes into an A&E department and it still feels like, you're having to sort of drag that understanding going forward. That's tricky. It's an ambition. It's to aspire, but it will sustain. We're also going to make quite sure that through the work of the Trust, the RCGP work, the criminal justice system, and also the voluntary sector, that we look at variation and we support that variation. We'll work out why there is variation, sometimes to do with rurality, to do with urban, to do with necessarily some of the distances that people even have to travel. So it's incredibly practical elements that we have to look at within the NHS and the Armed Forces community. But the NHS is vital to the defence of people and the defence of medical services and objectives. I'm standing here in probably the most difficult times in certainly my and our generations around conflict. And so it is absolutely important that not only the work that we do for the Armed Forces Covenant, but the work that we do to ensure that our commitment as the NHS to the defence community is absolutely central for what are the unknowns and some of the knowns of the years to come. So lastly, there is, for the NHS, Tim, I think you've highlighted it brilliantly today, 2 approaches to how we continue going forward. One is how we commit, design and resource designed and supported Armed Forces community and partnership work. And I think the work that the VCHA have done and Veterans Aware is exceptional. And I'm so looking forward to you supporting us with these commitments and challenges in the future. But the most important one for as a director in NHS England and as a partnership director through and through is getting it to be everyone's mainstream business. We talk about this as part of safeguarding, and that has its challenges. But this is everyone's business. And it doesn't necessarily have to be part of a funded Armed Forces labelled service. But my gosh, does it help if it is? as part of what is amazing value when you look at pound per head per person per patient, and what that means even more so as part of pound per head per person per population. And then lastly, this is about a whole community. This is about what this means for women and girls. This is what it means for a younger population of our armed forces, veterans community, but also the way that people are recruited into the armed forces community. It certainly means that we celebrate that. Guy, you can help me because you're blooming good at that one. Celebrate what that means for that difference, but also from NHS England's point of view, standing here today, I think that this is only going to get better. But I think obviously we've got a little bit more to do in order to make quite sure that this is sustained and embedded, but also at the level and understood, particularly by a new ministry and minister portfolio. The next 18 months is going to be blooming busy. So thank you very much indeed. Thank you.